I am a native of Wichita, a mom of three, and someone who works with youth every day. It's important to me that Wichita protect its kids from dangerous tobacco and vaping products. I'm proud that Wichita has a tobacco retail license in place that includes inspections to make sure stores are obeying the law, keeping Wichita's youth out of harm's way. This is important because research shows that holding retailers responsible at the point of sale is the most effective way to reduce youth access. Too many children and youth are using tobacco products. Oftentimes, children do not understand the mental, cognitive, and physical effects of using tobacco and vaping products. They account for more than 500,000 deaths annually, which is more than AIDS, alcohol, illegal drugs, murders, and suicides combined. Tobacco companies continue to aggressively market these products to kids. It is estimated that $74.2 million was spent in Kansas tobacco advertising last year. These ads are often targeted at historically marginalized groups. This has contributed to their disproportionate share of a tobacco-related disease burden. Tobacco-Free Wichita conducted a store audit and found that the number of tobacco retail outlets, proximity to schools, and outdoor menthol advertising are all higher in lower income zip codes. 71% of Wichita retailers were within a half mile of schools or parks. Wichita's TRL contributed to inequities in our community, and we have suggestions to make it better. Despite numerous sales to Wichita youth last year, retailers weren't punished. Only the low-wage clerks received citations. This allows stores to continue profiting from selling to kids without facing consequences for violating the law. This isn't fair. There's a local fine of $55 for PUP penalties, a full day of wages for a parent making minimum wage. Given the targeting of historically marginalized groups, it isn't surprising that Wichita data shows nearly half of PUP citations were given to Black and Hispanic youth. When the age was raised from 18 to 21 to purchase tobacco and vaping products, it was never intended to punish youth. It was intended to restrict sales to youth. Wichita can do better by updating its TRL to help keep our youth safe from illegal sales of corporate tobacco.
Hi, my name is Dr. Michelle Ban. I am here to just share with you a little bit about why I am a part of the American Heart Association advocacy piece. As a former teacher, I have seen the power and the devastation of addiction to tobacco with young people. As a wellness coach, I have seen and understand that when a person is using or smoking tobacco, their recovery time is a lot longer, their healing takes a lot longer, and it is a lot easier for them to have immune issues. As a youth advocate, because I do wear a lot of hats in the community, as a youth advocate, I've seen the devastating effects of what happens when our young people are being ticketed and fined for having tobacco, for having paraphernalia, when in reality, who should be ticketed, who should be given those fines should be the person whom they purchased it from, and or even the person who manufactured it, because our young people are not doing that. And so as we really think about advocacy for our youth, as we really think about who should be getting these fines, who should be getting all of these things, we really need to look at where is the source? Where is the source of tobacco use? Where is the source of the addiction? Where is the source of where our students are even finding these messages? And that's where we really need to begin to attack. And so as we look at advocacy, as we look at how do we go in and how do we really share a message of making sure that our young people are getting the message of not smoking and good health, we want to make sure that we are that voice. So thank you.
My name is Liz Hamer. I'm the founder and CEO of Center of Daring and an LGBTQ advocate. It's well known by LGBTQ advocates that tobacco companies intentionally target the LGBTQ population and that LGBTQ youth disproportionately use tobacco products, greatly compounding many health and social disparities that already exist. LGBTQ youth include kids with intersecting Black and Brown identities who are also greatly disproportionately affected by tobacco targeting and use. Knowing this, why then do we as a society punish our vulnerable youth disproportionately for our own failure to protect them? As a society, we have allowed these deceitful corporations to prey on the vulnerabilities of LGBTQ youth, and then we layer punitive citations on them that not only do not address the underlying racial and social disparities, but actually exacerbate the problems. And what can we do about it? What can you do about it? Because of all of this and more, I support the Wichita Tobacco Retail Licensure Fairness and Responsibility Update. Thank you.
I'm tired of seeing smoke shops. People think I'm a hater because I say, I'm tired of seeing smoke shops because of the business aspect of it. I don't want to knock people from getting money, but that's all we can do.
It's kind of dumb how they just make you, how they just let the tobacco stores and cigarette stores make all that money and make all the kids lose, they're basically losing their lives doing that.
Hello, my name is Alberto Reyes. I work every day with people who are struggling with tobacco addiction. I support an update to the tobacco retail license. Studies show that a penalty to the youth for use of possession is not a constructive way to reduce or treat youth addiction. Focusing on the point of sale is the most appropriate way to protect young people from the negative effects to their physical and mental health that addiction to nicotine can cause. Our youth are dealing with a lot of pressures. We should approach their tobacco use with care, not with punitive, ineffective punishments.